हाय एवरीवन, वेलकम। आज आपके साथ डिस्कस करूंगा रिपीट ब्रीडिंग सिंड्रोम। व्हाट इज अ डेफिनेशन ऑफ रिपीट ब्रीडर काउ? अ काउ that has been bred thrice or more than 3 times but is unable to conceive. This is mainly because of two factors. First is failure of fertilization and second is early embryonic death. This cow is having a normal estrus cycle. This is also free from palpable abnormality. This cow have no abnormal vaginal discharge. These are the normal things. But despite these factors, this cow is unable to conceive. So these are two main etiological factors: fertilization failure or early embryonic death. What are the main factors which are responsible for repeat breeding syndrome? Number one is genetical factors, hereditary chromosomal defects, inbreeding. Number two is artificial insemination, poor quality of the semen, improper or incorrect insemination technique, failure to detect estrus, or improper timing of the insemination. Environment: high temperature of the environment, high humidity, poor quality of nutrition, and improper housing arrangement, that is very low ventilation. Apart from these uterus factors, infection in the uterus and biochemical changes in the uterus of the dam. Ovarian functions, delayed ovulation, progesterone deficiency. In this video, we will discuss all of these factors in detail. Let's start with the fertilization failures. In a repeat breeding cow, the fertilization failure may be higher, around 28 to 44% of cases. That is, out of 100 cases, 44 cases are due to the fertilization failure. What are the reasons behind the fertilization failure? Number one is abnormality in the ovulation. That is anovulation or delayed ovulation. What is ovulation? Suppose this is an ovary, this is an ova. So the release of this ova is called as ovulation. In case of anovulation, there will be no release of ova, but in case of delayed ovulation, the release of ova is there, but this ovum release is delayed. So as a result of both of these factors, the sperm is unable to fertilize this ova because there is no ova. Second reason for the fertilization failure is defective ovum. Friends, if this ovum is defective, so the sperm cannot fertilize this ova. These are the main factors on the side of cow. Now we will discuss the main factors on the side of bull. So the fertility of the bull is poor, or bull may be infertile. High sperm abnormality. The sperm of this particular bull is having abnormality, or there is very low sperm motility. So these sperm are unable to reach to the ova. So there will be no fertilization. Apart from this, there may be conditions of inflammation of the genital tract. So these are the main factors which are responsible for the fertilization failure. Very early artificial insemination. ओवा रिलीज हुआ नहीं है और आपने आर्टिफिशियल इंसेमिनेशन कर दिया तो भी फर्टिलाइजेशन नहीं होगा और उसकी वजह से रिपीट ब्रीडिंग सिंड्रोम डेवलप हो जाएगा उस पर्टिकुलर एनिमल के अंदर, काऊ या बफेलो. सम अदर फैक्टर्स विच आर रिस्पॉन्सिबल फॉर fertilization failures are some defect of genital tract. These defect may be congenital or acquired defect. So example of congenital defect is segmental aplasia. So segmental aplasia means, for example, this is a bovine uterus unicornis. Bovine uterus have two horns, that is cotyledons. This is one and this is another. So in case of segmental aplasia, small portion or large portion of the female genital tract is having aplasia. That is, there is no growth of that part, as a result of which there will be very high possibility of failure of fertilization. The second is acquired defects. These defects are ovarobursal adhesion, that is the ovary is adhesed to the any part of the body, so there will be no release of the ovum. Other reason may be hydrosalpinx. What is the meaning of the term hydrosalpinx? So these are the fallopian tubes of the cow uterus. So if there is any fluid inside these tubes, there will be hydrosalpinx, and the ova which is released by the ovary from here have to reach there like this, and sperm come from this side. So fertilization will occur here. But if there is any fluid in this fallopian tube, then this ova or sperm cannot mate. So there will be fertilization failure. Another reason for the fertilization failure is cystic ovary. There are two kinds of cyst. One is follicular cyst and other is luteal cyst. So in case of follicular cyst, there will be the condition of nymphomanic cow, and in case of luteal cyst, the cow will not be able to release the ova. Hence, there will be no fertilization. Now, we will discuss the second important reason behind the repeat breeding syndrome, that is early embryonic death. This early embryonic death accounts for 25% of the reproductive failure or reproductive wastage. Major portion of embryonic death occur between the day 8 and day 19 after the breeding. इसका मतलब ये है कि 8 दिन से लेके 19 दिन तक ये जो एम्ब्रियो की डेथ है हो जाती है. एज ए रिजल्ट ऑफ दैट द काउ विल रिटर्न टू द estrus cycle at the normal period of 18 to 25 days interval. और ऐसा लगेगा कि उस काउ में फर्टिलाइजेशन हुआ ही नहीं है और वो दोबारा से नॉर्मल estrus साइकिल में आ गई है. Now, what are the reasons behind early embryonic death? The most important reason is cytogenic abnormality. In normal cases, there is normal chromosome, but because of any problem, if the chromosomal aberration is there, that is more than one chromosome or defect in the chromosome or mutation, there will be early embryonic death, as a result of which repeat breeding cow syndrome will develop. Another reason can be unfavorable uterine environment. अगर काउ का जो यूट्रस है उसके अंदर इन्वायरमेंट फेवरेबल नहीं है तो जो एम्ब्रियो है उसकी डेथ बहुत जल्दी हो जाएगी. तो जो यूट्राइन का इन्वायरमेंट होता है वो किस किस फैक्टर से अफेक्ट होता है? मेनली वो जो काउ है उसकी न्यूट्रिशन से, जो डैम है उसकी एज से, और बाहर जो टेम्परेचर है उस एम्बिएंट टेम्परेचर से. अगर न्यूट्रिशन पुअर क्वालिटी का है या काउ की जो एज है वो मोर देन 10 ईयर्स है, और इन सभी केसेस में देयर इज हाई पॉसिबिलिटी ऑफ अर्ली एम्ब्रियोनिक डेथ. द अदर फैक्टर्स में बी hormonal imbalance and infection. Suppose the progesterone hormone, which is responsible for the maintenance of pregnancy, is very low. Then in this case, the embryo will die very soon. Apart from this, if there is any infection in the uterus, that may also result in the death of embryo. So how we can detect these factors? What is the diagnosis? These are the methods which we can use to detect the abnormality or repeat breeding. Number 1 is rectal examination. Number 2 is examination of vaginal speculum. We can also perform white side test, endometrial cytology and endometrial biopsy. Endometrium is, friends, basically the innermost layer of this uterus. This is the endometrium. So we can take cell from this endometrium and we can conduct cytology or biopsy. Now let's discuss the treatment of the repeat breeding. We will start with basic things. For example, we have to bring the animal into the positive energy balance by providing additional concentrate or green fodder to the animal. We have to make sure the mineral deficiency is not there. To correct that mineral deficiency, we can also provide mineral supplement. We can also check the semen quality. We must use high quality semen only because semen is the main factor which is responsible for the fertilization. Apart from this, artificial insemination timing can be make proper, or we can ensure the repeating of the artificial insemination. We can use insemination twice or thrice. How we can correct the problem of delayed ovulation? So if there is release of ova is delayed, so how we can correct this? For this, there are 3 or 4 hormones are available. For example, number 1 is gonadotropin releasing hormone. We can use 100 microgram of GnRH, or we can also use 1000 to 1500 international unit of luteinizing hormone at the time of artificial insemination. These are very important methods or hormones which are used for the treatment. If you are not having like using these, you can also use depot progesterone on the 5th day of the artificial insemination, because this is responsible for maintenance of pregnancy. Or you can also skip that artificial insemination or administer prostaglandin hormone. This hormone may result in the regression of the luteal cyst, and cow will enter into new normal estrus cycle, and thereafter you can do artificial insemination. So this is all about the treatment. Now we can discuss the conclusion. We have to make sure the uterus is free from infection, correct timing of artificial insemination, and assure quality of the semen.